Now, case number 5, a biopsy sample performed in a 30-year-old male patient with hepatosplenomegaly and jaundice. You have here a large core needle biopsy of this young patient. So he had cholestatic hepatitis. And what I did not told you regarding the clinical data, but it was on purpose, is that he also had mediastinal lymph nodes and micronodules in the lung. So now let's look at the biopsy. So it's really straightforward case. You have here the liver parenchyma, and what you can see is numerous epithelioid granulomas. They are located mainly in the portal tracts. Here, probably a large portal tract that has been enlarged by the numerous granulomas. It's hard to identify the former structure and the former components of the portal tract. So it was the main pathological findings in this case. Again, really typical ones: epithelioid granulomas, multinucleated cells. So this was a case of sarcoidosis. Of course, you cannot exclude an infection due to mycobacteria, but in this case, the diagnosis of sarcoidosis was further confirmed. So the main issue with the liver sarcoidosis is that the granuloma will progressively may destroy the bile ducts, so you may have ductopenia. The granulomas are mainly located in the portal tracts, but you may have some also in the lobule. And this case was really typical because of the number of granulomas that you can see even at low power. And usually in those cases, the granulomas are really easy to identify in liver sarcoidosis. So the prognosis due to the destruction of the bile ducts may be adverse, and some patients may undergo liver transplantation, and we had a few cases. So really a typical textbook slide of liver sarcoidosis.